In this presentation, we'll cover the vascular access needs and options for therapy with the Aquadex SmartFlow. By the end of this training, you should understand the following: keys to therapy optimization, the dual lumen extended length catheter or dELC specifications, dELC placement, insertion, positioning, patency, and stabilization considerations, alternative venous access options for adults and pediatric patients, and anticoagulation considerations. The two primary goals for optimization of Aquadex therapy are good access and adequate anticoagulation. For access, you must have a compatible catheter for venous access and have good vein selection providing adequate circulation. You must consider catheter placement and catheter tip positioning and confirm that there's adequate blood flow. For anticoagulation, it's recommended to have therapeutic levels of anticoagulation as appropriate per hospital protocol. Venous access considerations. The following are the recommended venous access catheters for use with the Aquadex SmartFlow system. For peripheral venous access, the dual lumen extended length catheter or dELC, and for central venous access, a central venous catheter with lumen diameters less than or equal to 16 gauge, in other words, a gauge size of 16 or lower, illustratively, a dual lumen CVC with two 14 gauge lumens, a dual lumen CVC with two 16 gauge lumens, or a quad lumen CVC with at least one 14 gauge and one 16 gauge lumen. Nuwellis can provide a list of catheters that fall within the guidance stated on the previous slide. This includes a list of examples of catheters that provide adequate blood flow with the Aquadex SmartFlow system. A list of pediatric catheter options may also be provided, if applicable, as seen here. The dELC is indicated for use in attaining vascular venous access for use with the Aquadex SmartFlow system. It is provided sterile for single use only and is indicated for peripheral use only. Placement above the antecubital fossa is recommended. The catheter is not intended for the infusion of medications or fluids, for laboratory sampling, or other venous access needs. The catheter is contraindicated whenever local tissue factors prevent proper device stabilization and/or access and where MRI is anticipated. The catheter has not been tested for MRI compatibility. Here you'll see a summary of the dELC product specifications, including the part number, sizing, and materials. The placement of the catheter should be above the antecubital fossa in a vein with the largest diameter and the least tortuosity. Ultrasound guidance is recommended to determine the best vein. The basilic or brachial veins are recommended. We recommend an internal diameter of at least 4 millimeters. As a reminder, the catheter has a fixed length of 15 centimeters, so it is important to consider the location of the tip of the catheter by measuring the distance from the insertion point. This can be done using a sterile measuring tape or a string cut to 15 centimeters. Avoid proximity to venous valves, and always follow appropriate hospital policies and procedures. Visualization of where the catheter tip will reside is especially important with Aquadex therapy, as that is where the withdrawal and infusion of blood is occurring. During placement, assess resistance to help determine the optimal position. The introducer sheath may be split outside the skin and removed to allow catheter advancement and placement. Avoid placement of the catheter tip where kinking may occur, particularly in the axillary bend. If the catheter tip is past the axillary bend, which may provide for maximal flow based on anatomy, radiography imaging is recommended. In the image shown, the insertion of the catheter is in the upper bicep and the tip is past the axillary bend. If positioning the tip past the bend is not feasible or not aligned with institutional policy, ensure that the tip is before the bend in the area of maximum vein diameter, avoiding proximity to valves. dELC insertion considerations. The dELC should be inserted using the modified Seldinger technique. Once it's inserted, assess line patency. Secure and apply the dressing to the catheter entry site, and always follow the appropriate and applicable local, institutional, and hospital policies and procedures. The dELC should be secured with a stat lock or equivalent securement device and a sterile dressing per hospital protocol. This will prevent accidental dislodgement or removal of the catheter. Ensure that any securement device does not impede flow or create a kink in the catheter. During therapy, anticoagulation is recommended to prolong the life of the filter. Heparin is the most commonly used agent. However, other anticoagulation agents may be used if heparin is contraindicated, such as argatroban. Anticoagulation is often administered at least 30 minutes prior to beginning therapy. The example therapeutic ranges are shown. For details, please refer to your standing order. Certain circumstances may exist whereby patients may not be candidates for systemic anticoagulation. These include recent surgery, pre-existing diseases or comorbidities, or other contraindications. In that case, alternative anticoagulation strategies may be used, and there are recommendations provided. Always refer to the product's labeling and instructions for use documentation.